parotid and submandibular gland. Now, boundaries of the parotid bed. You have to know the parotid bed. You know the parotid gland is located in the face, just in front of the ear, and the masseter muscle. Now, anteriorly, the posterior border of the ramus of the mandible, and posteriorly mastoid process. This is the mastoid process, and superiorly external acoustic meatus over here. This is superiorly the external acoustic meatus. Meatus and posterior part of the temporomandibular joint. This is the temporomandibular joint. Now, and medially styloid process. The styloid process. Now, this whole zone is boundaries of the parotid bed. Next. Now, muscles lining the parotid bed. Important. The muscles lining of parotid bed, ramus of the mandible, masseter and medial pterygoid. You can see the masseter muscle and mastoid process and the posterior belly of the digastric. Posterior belly of the digastric muscle. Styloid process, styloglossus, stylohyoid, and stylopharyngeus and stylohyoid muscle. This is the styloid process. You can see the styloid process with attached muscles. Now, styloid process, the attached muscles are styloglossus, stylopharyngeus, and stylohyoid. Now, stylopharyngeus, styloglossus, with the tongue, and the stylohyoid. Now, from the styloid process, it is attached with these. Next. Now, extent of the parotid gland above, just beneath the external auditory meatus. This is the external auditory meatus. Below, upper part of the carotid triangle. Medially, styloid process above and neck of the mandible below. Posteriorly overlaps, anteriorly extends over the masseter. Now, accessory parotid gland, anterior part of the gland may get detached from the rest of the gland. Lies between zygomatic arch, this zygomatic arch here, above, and parotid duct. This is the parotid duct. This is parotid duct. So, zygomatic arch and the parotid duct, and lies between the zygomatic arch and above the parotid duct below. Next. Coverings of the parotid gland. Now, you see this diagram. This is the parotid gland. This is the cut part of the zygomatic arch, the superficial lamina of parotid fascia, parotido-masseteric fascia, and the investing layer of the deep cervical fascia. Now, the deep lamina of parotid fascia, submandibular ligament, the styloid process, the tympanic plate. This is it's important for a 4 marks question or 5 marks question. It is important. So, please note these figures. It is available in all the textbooks. Okay. Now, inner true capsule and outer false capsule. True capsule, condensation of fibrous stroma of the gland, and false capsule is splitting of investing layer of deep cervical fascia. That's why any inflammation of the parotid, it becomes very painful. And now the inflammatory swelling is painful because of the anatomical structures, that is the coverings of the parotid, inner true capsule and outer false capsule. True capsule, condensation of the fibrous stroma of the gland. Now, the condensation of the fibrous stroma, that doesn't release. Naturally, it's very painful, and false capsule splitting of investing layer of deep cervical fascia. Now, this deep cervical fascia and inflammatory swelling is painful. Now, false capsule of the parotid gland. Now, superficial and deep lamella. This is superficial and the deep lamella. This is the superficial lamella of the parotid fascia and parotid-mesenteric fascia. This is the investing layer of the deep cervical fascia. Anteriorly and posteriorly, you can see the styloid process here, the tympanic plate and stylomandibular ligament. The ligament arising from the styloid process, deep lamina of the parotid fascia. This is the deep lamina. These two form the investing layer of deep cervical fascia. Similarly, superficial and deep lamella. Superficial lamella blends with the epimysium of the masseter and parotido-mesenteric fascia. And parotido-mesenteric fascia is attached above with the zygomatic arch. This is attached with the zygomatic arch. And deep lamella thickened to form the stylomandibular ligament. This is deep lamella form the stylomandibular ligament. Stylomandibular ligament extends from the tip of the styloid process and from the tip of the styloid to the angle of the mandible. To the angle of the mandible from the styloid process, it extends. Now, see, this is the zygomatic arch, this is the masseter muscle, this is the mastoid process, sternocleidomastoid muscle, facial nerve, parotid gland, and this is the digastric muscle. Now, presenting parts of the parotid gland. Now, see the simple drawing. This is the pyramid. It's pyramid-like apex and base, superficial and lateral surface, or anterior medial surface, posterior medial surface, anterior, posterior, and medial borders. Now, you can see the medial border, posterior medial surface, posterior border, anteromedial surface, anterior border, and the superficial surface. This is superficial surface. This is represented with the facial nerve. Next. Now, apex of the parotid gland. Apex of the parotid gland extends into the carotid triangle. See, this is the external aquatic meatus, this apex, and this is the parotid duct. And you can see the vessels here, band from posterior to anterior, vein, artery, nerve, and over auriculotemporal nerve, superficial temporal artery, and superficial temporal vein. Now, structures passing through the apex, structures passing, cervical branch of facial nerve, anterior division of retromandibular nerve, and posterior division of retromandibular vein. This retrotemporal, this apex. Next. Base of the parotid gland, concave in lining, related to external aquatic meatus. This is concave in external meatus and posterior part of temporomandibular joint. Structures passing through the base, temporal branch of the facial nerve, auriculotemporal nerve, and superficial temporal vessels. Next. Now, superficial surface of the parotid gland, skin, superficial fascia, superficial group of parotid lymph nodes, and superficial lamella of false capsule. Superficial surface of parotid gland, skin, superficial fascia, superficial group of parotid lymph nodes, superficial lamella of false capsule. Next. Now, anteromedial surface of the parotid gland, related to posterior border of the ramus of the mandible. The posterior border of the ramus of the mandible, the anteromedial surface, and the structures related to the branches of the facial nerve and maxillary artery. Next. Now, posteromedial surface of the parotid gland related to mastoid and styloid process of the temporal bone, related to and posterior belly of the digastric, related to muscles of the styloid apparatus. Facial nerve enters parotid gland by piercing this surface. This is the facial nerve. You can see the branches of the facial nerve. Posterior border of the parotid gland separates superficial and posteromedial surface. Now, posterior border separates superficial and posteromedial surface. Structures related. Now, see this border. It is like this. It is like a wedge, and the structures related to the posterior auricular branch of facial nerve and posterior auricular vessels. Next, the anterior border of the parotid gland separates superficial and anteromedial surface, and the structures related to zygomatic upper and lower buccal and marginal mandibular branches of the facial nerve. Zygomatic upper and lower buccal and marginal mandibular branches of the facial nerve. Transverse facial vessels. Parotid duct, this is the parotid duct, and accessory parotid gland and duct if present. Next. Now, structures passing through parotid gland, facial nerve and its branches, retromandibular vein, and external carotid artery. That, see, when the viscera is given, the parotid gland viscera is given to you, you have to describe, and especially you start with that it's a pyramidal shape, it's an apex and base, and medial border and posterior border. Next. Now, facial nerve, see the facial nerve. This is the facial nerve trunk. This is the temporal branch, zygomatic branch, and over here it's a buccal branch, and this is the marginal mandibular branch. This is the marginal mandibular branch, and this is the deep lobe. This is divided the isthmus, facial trunk, and the temporofacial trunk, and temporal branch and the zygomatic branch. And this is the deep part of the lobe and cervicofacial trunk. This is cervicofacial trunk. Now, emerges from the stylomastoid foramen. Stylo and mastoid foramen, stylomastoid foramen pierces the posterior medial surface, runs forward as the most superficial structure, divides into temporofacial and cervicofacial trunk. 5 terminal branches emerges from the anterior border, branching pattern known as ancillarianus. Branching pattern. This branching pattern is known as ancillarianus. Now, facial nerve can be a question of at least 10 marks or in between 5 marks. It's very important. It can come in theory, and also you will be asked in practicals. Next. Surgical importance of facial nerve branching. Surgical importance of facial nerve branching. Now, you can see the branches of the facial nerve. This is the isthmus between the deep lobe and the superficial lobe. It bifurcates in the isthmus and carries on. Now branches of the fasciculum divide into divide the parotid gland into superficial and deep lobes. The branches are sandwiched between the two lobes. This orientation helps the surgeon to remove a parotid tumor, leaving the nerves intact. Now, this is very important because if the nerve is cut, then there is facial palsy. So, the nerve is cut, there will be palsy of the. Now, the branches, see, it is being sandwiched here between the two lobes. This orientation helps in the the surgeon to remove a parotid tumor, leaving the nerves intact. Next. Retromandibular vein occupies the intermediate zone. Now this is the retromandibular vein. And the posterior auricular vein, the facial vein, the common facial vein, and the external jugular vein is the external jugular vein. See, superficial temporal vein, the transverse facial vein, retromandibular vein. This is occupies the intermediate zone. This is the retromandibular. Occupies the intermediate zone formed by union of superficial temporal and maxillary vein, superficial temporal and maxillary vein, and divides and emerges as anterior and posterior division. Anterior and posterior division. Next. External carotid artery occupies the deep zone, divides into terminal branches, and maxillary artery lies deep to anteromedial surface. Superficial temporal artery emerges from the base. Transverse facial artery emerges from the anterior border. Now you can see the superficial temporal artery, the transverse facial, is the maxillary artery, external carotid and posterior auricular vein, artery. Now see every part of parotid gland, the anatomy, it is very important. And especially surgical importance due to any parotid tumor is there, or if you feel that it's an abscess or something, you just don't cut. You give analgesic, antibiotics and rest and refer to the ENT surgeon, because previously the general surgeons used to operate on, but as there is super specialty, your duty as a medical officer or emergency officer, then you just think of the total pathology and the anatomical aspects of parotid gland. We keep it in mind. Next. Now, parotid duct, Stensen's duct, length 5 centimeters. This is just 4 marks question. Or there will be some, your MCQ can be there, but it can be a 4 marks question. It's a very common part. So, length is 5 centimeters, formed within the gland by union of 2 vertical ducts. Okay, emerges from the anterior border of the gland. This is the parotid duct. Next. Now, course of the parotid duct. This is very important. The duct passes forwards on the masseter muscle. This is the buccinator. This is the parotid duct. This is the masseter muscle here. And buccal pad of fat. And this is the parotid papilla. Now pierces the buccopharyngeal fascia and buccinator muscle, and at the anterior border of the masseter abruptly turns medially. You do like this. Okay? Do like this and curve it. The anterior border of the masseter. You just do this. And you can, so you can see you can locate and anterior border of masseter abruptly turns medially. Again it moves off. Yeah. It goes like this and then it moves off. In anterior border, it just turns up. Abruptly turns medially, pierces the buccopharyngeal fascia and buccinator muscle. This is the buccinator muscle, this is the buccopharyngeal fascia. The green is the buccopharyngeal fascia, this part. This is the buccal pad of fat. Just clench your teeth and you feel the masseter muscle and passes between the buccinator and mucous membrane of the cheek. Opens opposite the crown of the upper second molar tooth. This is the parotid papilla, the upper, opens opposite the crown of the upper second molar tooth. This part. If you asked in the viva that where does the parotid duct end, then you say the upper molar tooth, the crown of the upper molar tooth. Next. Now, blood supply of the parotid gland, arterial supply derived from branches of the external carotid. Veins drain into the tributaries of the external jugular vein. Blood supply, parotid gland, anterior supply, arterial supply derived from branches of the external carotid and veins drain into the tributaries of the external jugular vein. Next. Now, nerve supply of parotid gland, secretomotor supply from parasympathetic and sympathetic. Secretomotor, because lots of saliva and the gland. And see, one thing I tell you, that if there is any inflammation of the parotid, what I do is that I tell the patient to take these poppins or Hajmola lozenges, any khatta. It can be imli or thing, because there's lots of secretion and that goes out. And the inflammation is reduced. That is my experience. Just write antibiotics or anything, that is the thing. You tell the patient to have a gargle, at least after each food she takes, the patient takes, and gargle, warm saline gargle, and also in between they'll be sucking Hajmola lozenge or Poppins lozenge or any khatta, whatever there is preference is there, because that lots of secretions come out and slowly with the analgesic and pain it goes reduced, I would say. Now, secretomotor supply for parasympathetic and sympathetic. Parasympathetic stimulation, watery secretion. Sympathetic secretion, mucus, rich, sticky secretion. Next. Now, parasympathetic nerve supply, preganglionic fibers, inferior salivatory nucleus of medulla. The salivatory nucleus of medulla, when you touch, read the brain and the different nuclei of the brain and the tracts, ascending tracts, descending tracts, fibers pass through the tympanic branch of 9 cervical nerve, reaches tympanic plexus, relay into the otic ganglion, Post-ganglion fibers reach the gland via auriculotemporal nerve. Next. Now, sympathetic nerve supply, preganglion fibers from sympathetic trunk relay into the superior cervical ganglion. Post-ganglion fibers reach the gland around the external carotid artery. Next. Now, Frey's syndrome, penetrating wound of parotid gland damages auriculotemporal and great auricular nerves. During healing, secretomotor fibers of auriculotemporal nerve joins distal and of the general nerve through the sympathetic fibers reach the sweat glands of the facial skin. During eating, perspiration occurs on the skin covering the parotid, and stimulus intense for salivary secretion produce sweat secretion. Now, stimulus intended for salivary secretion produces sweat secretion. Now, Frey syndrome. Next. Now, you can see this is a picture from Thymes Atlas. I'm showing you, and you can see the parotid duct here, the accessory parotid gland here, the parotid gland proper. This is the masseter muscle, and this is submandibular gland is here. This is the buccinator muscle. See the duct, parotid duct just abruptly turns over here, and then here is the buccinator muscle, buccinator fascia, and this is the facial nerve, facial artery, and facial vein. This is the facial artery and facial vein. You can see the masseter is contracted. Then you can feel the pulse at this level. You can feel it. Okay. And now superficial temporal artery and vein, the parotid gland here, the parotid facial nerve, this is the facial nerve, and parotid gland here, and sternocleidomastoid muscle. This is the auricle. Now, the temporal, this is zygomatic branch of the facial nerve, this is the buccal branches of the facial nerve, marginal branches of the submandibular, and parotid plexus is here, posterior auricular nerve, facial nerve proper, and nerve to digastric, posterior belly, nerve to stylohyoid and cervical branch. This is cervical branch. Now, see, the thing is that the jaw is open, and you can see the genioglossus muscle. This is the submucosal subbuccal fold. This is the papilla opening, sublingual papilla. This is the oral mucosa. This is the teeth. This is the cricohyoid muscle. This is the hyoid bone, and stylohyoid and lingual artery is here, lingual artery. And see the submandibular gland. This is submandibular gland. This is submandibular gland. Next. Thank you.